Seeing people at home has so many advantages, and from a professional point of view it gives us a chance to develop a rapport with the patient and spend the time that they need with them. Often in a hospital or a clinic situation it's very, very busy. There's lots of patients to see in a short amount of time, whereas in the home it's one-on-one.
Our processes are that we come to the patients and when it's convenient for them.
When you're having chemotherapy at home, we bring all of our equipment and all of the medications to you.
She sets it up and we sit and we chat for perhaps a couple of hours. She tidies me up and goes on her way.
It's perfectly safe to have treatment at home. We have all of the safety equipment that we need. The nurses are all very well trained and very experienced.
We're able to keep an eye on them at the whole time that they're having their infusion and make sure that if there was any problems that we'd see them early and we'd be able to act on them straight away.
I definitely feel just as safe as being in the hospital, having a hands-on nurse that's actually with you, sitting next to you the whole time that you're having the treatment.
People can sleep in their own beds, they're not separated from their families, they can take their kids to school. We even see some people who are working, so we'll go and see them early in the morning and then they can go to work in the afternoon.
I get to sit down in my back games room, I get to watch a movie or watch TV.
We correspond frequently with the doctors so that they're well informed of what's happening in the community, so that they know that the treatment's going ahead without any problems.
Chemotherapy patients seem to have less side effects because they're more relaxed and they don't have the extra stress of parking and seeing their doctors, waiting for their treatment, getting home late.
When a patient is referred to our service, we will make contact, generally with a phone call or a visit, and discuss the service with the patient and their family, give them the opportunity to ask us any questions.
Coming from a hospital environment myself and only having worked with this company since last September, the difference for the patients is far beyond anything I ever imagined.
You sort of establish a rapport because you sit down and whilst the healing medicine is flowing into your veins, you chat away, you ask about each other's families and talk about cooking. And it's really, in many ways, quite a social occasion.
I get to go to work for my first part of the day and then I can have it in the afternoons if I want or around lunchtime and still continue with my happy life.